On October 16th, 2021, the reporter EIC email was forwarded a message from a professor to President Munson regarding the vaccine mandate for professors. The professor told our editor-in-chief, quote, "Feel free to quote from my email to Munson," end quote. I will now read the entire message, word for word, in one take. Dear President Munson, regarding the vaccine mandate, I know, you're just following orders, but all 3 coronavirus vaccines are still experimental. It is immoral to force people to inject an experimental substance into their bodies. The World Health Organization on its website right now states that it is a violation of human rights to force medical treatment on people. I have never heard of a university that imposed a vaccine requirement on professors, not even for chickenpox. What you are doing is changing a work contract after it has been signed. If I had to guess, no professor's contract says, quote, "The university has the right to enforce me to inject an experimental substance into my body, or else fire me immediately, even after I get tenure." Did you deliberate with faculty and the professors' union, or is this a diktat with no discussion? Did the faculty vote in favor of this mandate? Note that even if they did, a majority cannot vote to remove the rights of a minority. It is still illegitimate for 2 wolves and a sheep to vote on what to have for dinner. Can you tell us how many professors support the vaccine mandate and how many oppose it? Can you tell us how many professors support vaccine mandates in the abstract, i.e. not necessarily this one, but the abstract idea that the president can force you to inject yourself with a substance whether you want to or not? And how many did not? Do the conditions of tenure allow you to fire a professor for a reason like this? You act like you have no choice. You always had the choice between firing tenured professors and not taking new federal contracts. Can you show us the transcripts of the meetings where you discussed these 2 options, along with the names of the administrators and faculty members who voted for the option of firing tenured professors? Is there any other rule affecting all faculty that you have mandated without consulting the faculty government body? It is not necessarily true that the vaccine is the best way to handle the pandemic, as you write. That is why we have what are called discussions or even debates. With 2 million untested, illegal immigrants coming across the border a year, obviously the pandemic isn't going to be ended by forcing 1,500 RIT professors to be vaccinated. Stopping a pandemic may be nice, but it is not a concern of the university president. Your concerns are with professors and students, class scheduling, etc. Parentheses, indeed, all 3 will be adversely affected if anyone refuses to bow to you by December 8th. End parentheses. Regardless, you do not get to decide what is of concern for professors. They might or might not care about stopping the pandemic, or they might have different ideas about how to stop a pandemic, and they might care more about their personal health than about the globe. We already know that the vaccinated can get infected and infect others. The requirement that remote workers should be vaccinated is insane. At least acknowledge that it is insane. Why is testing negative for a coronavirus not an option? Even Biden said, quote, "The Labor Department is going to shortly issue an emergency rule to require all employers with more than 100 people, whether they work for the federal government or not, this is in the purview of the Labor Department to ensure their workers are fully vaccinated or facing testing at least once a week." Emphasis mine. Biden added, quote, "If I come here to Clayco to thank this company for doing the right thing, Today, Clayco is announcing it's going to require all its employees to be fully vaccinated or test once a week. Biden's orders are still a violation of human rights and possibly illegal, but he said testing is an option. Why aren't you allowing that? The statement about religious exemptions in your email was also insane. You get to decide whether someone else's religious views are deeply held? Where's that in the executive order or in the law? St. Augustine was a heathen one day and a Christian the next. If you met him the day he converted, you might conclude that his views were not, quote, sincere, because he'd only been a Christian one day. Is there any other situation involving religious exemptions with such a stringent test? George Mason University imposed a vaccine mandate. They were sued and revoked the mandate. You'll be sued too, I hope. Perhaps as an individual and not just as RIT. 24 states have threatened legal action against the Biden administration because of the mandates. No one would have faulted you for delaying just because you were waiting on the courts. On January 27th, 2017, Trump signed an executive order. It was blocked by the courts. So on March 6, 2017, Trump had to issue a new executive order. So you cannot use the mandate as a fig leaf. You are the one demanding that professors kowtow to you. Biden's executive order, even ignoring the Nixonian idea that because the president does it, it is legal, says that it does not apply to grants. RIT is in the clear, since I assume the money RIT gets, the money you are so worried about losing, is from grants. If RIT is a federal contractor in any other way, an honorable university president, instead of firing professors, would instead say that RIT will give up those contracts for the greater good. It is the same as if a donor attaches strings to a donation. You might want the money, but you say to the donor, no thanks. You think that RIT can't exist without federal contracts? When did that become the case? The Biden executive order says that it applies to workers working on federal contracts. How is an ordinary professor working on a federal contract? The Biden executive order said it does not apply to existing contracts. Why are you acting as if it does? The Biden executive order says it does not apply to contracts below the simplified acquisition threshold, which appears to be $250,000. Why are professors who make much less than that being forced? Is there any other rule affecting all faculty that you might have mandated with such alacrity? Regarding the urgency, which is not a university president's concern, did it not give you pause that the college football games appear not to have contributed to, quote, super spreading as predicted by health authorities? Does it not give you pause that Biden made at least 2 false or misleading statements about coronavirus in speeches last month and this month? He says that, quote, only 1 out of every 160,000 fully vaccinated Americans was hospitalized for COVID per day. It has been reported that 95% of these severe coronavirus patients in an Israeli hospital are vaccinated people. The, quote, PA Department of Health report showed that unvaccinated people still account for 74% of the 4,989 hospitalizations over the last month, end quote. That means 26% of the people hospitalized for coronavirus were vaccinated. Biden also stated that the vaccine cannot transmit the virus to others. Quote, we're making sure healthcare workers are vaccinated because if you seek care at a healthcare facility, you should have the certainty that the people providing that care are protected from COVID and cannot spread it to you, end quote. But that is false. Indeed, Fauci said that a vaccinated person can have a viral load identical to an unvaccinated infected person. And as has been said, the vaccine mandate is saying that in order to protect the protected, the unprotected need to get the protection that doesn't protect the protected from the unprotected. The argument that the hospitals will be overwhelmed by coronavirus patients, besides not being a concern of a university president, is bogus, since thousands of doctors and nurses have been fired for not taking the vaccine. So many doctors, nurses, and all hospital staff have been fired that the New York governor has declared a state of emergency. By the way, don't you think that you should ask doctors and nurses why they don't want to take the vaccine? 25% of German doctors don't want the vaccine. Why did Sweden pause vaccinating people under 30 with Moderna, but you are mandating vaccinations for students and professors, many of whom are under 30? Why are hundreds of teachers and others in New York City protesting? Why are many policemen in Los Angeles County on the verge of quitting? So many that the sheriff had to say he will not enforce a vaccine mandate because he'd lose too many officers. Why are people who have already been infected required to get the vaccine? Your answer is that the mandate says so. But as the president of a university of technology and science, shouldn't this give you pause? Does it not give you pause that Biden, Fauci, and Psaki all said that they would not or could not mandate vaccination? What changed legally between then and September of 2021? Besides the Afghanistan debacle, which of course is completely coincidental. You may be under the impression that those who oppose the vaccine mandates are Republicans. And you may hate Republicans, but 70% in New York City were unvaccinated before the mandates. They were almost all Democrats. You're actually more like the people who conducted the Tuskegee Civilis experiment. You are forcing faculty and staff to inject themselves with an experimental serum. The vaccine manufacturers require the people who do so to sign a waiver absolving the manufacturers of any responsibility. Will you pay the medical bills of these people? Can you tell us the long-term effects of the vaccine? Can you tell us if the human trials for the vaccines have been completed? Can you tell us the percentage of American college students, 18 to 21, who have died after contracting the coronavirus? Can you tell us what countries have a vaccine mandate? I can only think of Italy and the US, and this is what protests look like in Italy. Mandates are pretty popular.